Hi guys, very nice to meet everyone. So my name is Anna. I'm the CEO and founder of BaseBuzz. BaseBuzz is a pet genetics company, and today I'll tell you a little bit about the company and a little bit about the work that we're doing. And before I begin, I feel a little bit like an imposter here because I'm not a data scientist. I'm not even a scientist. I'm an entrepreneur. This is my fourth company, and my co-founder, who we'll talk about here, has been absolutely instrumental in getting the science part down. So if I make any mistakes, please just shout out and let me know. Otherwise, I'll try to cover as much of the awesome machine learning work that we've done and will be doing as I can. So we'll talk a little bit about pets and genetics and AI, what's going on in there. I'll cover personalized medicine and how BaseBuzz wants to be a player in personalized medicine in both pets and humans. We'll talk about some applications of machine learning and some of the problems with the current approach, where I really want to get you guys as excited about animal data and using animal models as I am, and what at BaseBuzz we're doing to help. Okay, great. So BaseBuzz is a pet genetics data company. So we're creating this world of DNA-based personalized pet products. And we're starting with something that we're calling the Cat Kit. And exactly, it's like 23andMe, but for cats, except that because there's a lot less privacy and policy concerns, we don't have the FDA breathing down our back. There's a lot more we can do with animal genetic data than we can with human data. We work really closely with breeders, with vets, with owners, and actually with pet companies to create what we're calling DNA-based products and services. And of course, this database, this biobank of feline data, is actually right now the largest in the world and will be used in pet nutrition and drug discovery, again, for animals and humans. So genetic testing for pets really, is this a thing? Absolutely, it is a thing. It is a big thing. If you've, can I just get a raise of hands? Who has a cat or a dog at home? Oh my God, usually it's like the whole room, or I just can't see. It's okay, I won't tell. So there's a lot of interest. Pet owners, I know, they want to get to know their pet better inside and out. This is one of the only ways they can actually do that. We have this really great test that we've developed. It's non-invasive, it's at home. It's proprietary. We have this really interesting, unique way of collecting DNA data. There's no spit involved. There's no blood tests. We actually take it from the fur, from the follicle of the fur. We've done quite a lot of work we have a laboratory in Los Angeles. We've done quite a lot of work in trying to understand what are we using. We're using something called GBS, genotyping by sequencing, which means we can have a lot more discoveries in the future as opposed to using a SNP chip. And even more exciting is that we have direct access to the data set. We have a direct access to pet owners who are very much involved in trying to get us more data to understand their pets better. Okay, so this is what the kit looks like. If you remember your 23andMe box, it's kind of a big box. It costs about $7 them to produce that. We have something that's very thin because we only ask for hair, which means we just send you this strip of adhesive tape. You put it on your cat. You kind of strip your cat. It's kind of like waxing your cat. It doesn't hurt them. And then you get, we get all this really, really powerful data for very inexpensively. It's 7 times cheaper for us to get that data than for someone like 23andMe. So we think of this as just like a really unique, cool way of acquiring data, which is not as expensive as in other companies. Our engagement is really, really high. Pet owners love this stuff. The phenotypic data that we have coming through is very thorough. There's a lot of it. We get really high response rates. It's translational. I'll talk a little bit about the cat, why the cat is actually, in terms of translational medicine, a really unique animal. And again, I mentioned that it's without the privacy and policy issues that sometimes get human genomics companies bogged down. And then this intersection, so between pet care, technology, and genetics is really exciting. This is what got us to the point where we're at right now. BaseBuzz is only a year old. We have over 2,000 samples of cats right now. People are approaching us from all over the world, sending us samples, interacting with us. Why now? Why wasn't this happening 10 years ago when 23andMe was just coming up? Well, there's a few factors. First of all, the cost of DNA sequencing continues to drop dramatically. We know that. The feline was just recently correctly sequenced in 2014. Before that, you couldn't do this. The whole idea of human genetic testing is growing, and people know about it. And now pet owners that have heard about it about themselves are doing this for their pets. And this whole idea of personalized pet care is following the human trends. So all of this just means that right now is kind of the right time to be collecting this database. This is our executive team and some of our advisors. We are a startup. We are a really small startup. There's only 3 people that are working for it full-time and about 8 that are doing this part-time and about 30 that are doing this for free. We have interns from all over the world that are giving us their time and their effort just to build this up and to make this a success. You know, myself, I come from a marketing, sales, and business development background, although I love biotech, and I think this is such an exciting field to be in. And my co-founder, Sean, is an MD, PhD in systems pharmacology and genetics with actually a focus on artificial intelligence. And some of the work that he's doing and will continue to be doing in this company is really, really exciting. So a little bit about personalized medicine. I think we've all known that personalized medicine long-term is going to be really, really useful for us. It will continue to improve outcome. It will reduce cost and avoid side effects. The story that it always sticks in my mind when it comes to personalized medicine is I think about, in 2011 when Steve Jobs was dying of cancer, he was spending up to $100,000 to get his genome sequenced and to go through this whole methodology of trying to understand which cancer drugs work better for him and what amounts based on his genetics. So we know that this is something that, especially in oncology, is really helping us. And there's lots and lots of applications of machine learning and personalized medicine in science right now, especially the field of oncology. I speak to Sean about this all the time, is that personalized medicine is becoming really an integral part of the way that oncology is functioning at the moment. So we understand that personalized medicine is important. We understand that machine learning is a part of it, but it's really not that easy. And when I speak to my co-founder about this, because this is something that he's really, really passionate about, here are the things that he always talks about. He says that, the research around personalized medicine is really siloed, so folks don't really share their research a lot. He went to school in Mount Sinai, and, he would be saying that someone said that we'd rather share your toothbrush than share your data. This is actually very similar to what he has told me about his experience in graduate school. There's not a lot of IP sharing. It's very difficult to get phenotypic data when it comes to personalized medicine. It's really time-consuming and, of course, expensive. And I go back to privacy concerns. It's something that we have an advisor from 23andMe, and this is something that's really dear and close to us. We know that this can actually put an absolute stop to research if someone at the FDA decides that this is something not to be used. So ethical concerns and privacy concerns, all of these problems come up around personalized medicine. So is there anything around animal models that can help? Before I go into that, and I really want to talk about cats in general, validating predictions is difficult, expensive, and at times impossible. I think at least half the presentations today talked about the fact that validation is really, really important. I can't also stress this point enough. A lot of people are coming up with models. There's lots of models available, but is there enough data and is there enough money to be doing validations as well? So I want to talk for a second about feline genetics. Cats are actually the closest mammals to humans outside of primates. And until 2014, cats, their genome wasn't available to be used, so they weren't really being studied as much. We really think that we can speed up the development of algorithms that can provide personalized medicine recommendations based on genetics using feline genetics. We will have hundreds of thousands of feline genetics data in our database. We really believe that data will be very robust. It will be low cost. It will be clean. And we think that this is something that scientists can be working on long term. Again, BasePass is a year old. We have really big dreams about where we want to go and how much data we really want to have. But just the interest that we have seen so far from the scientific community, from the pet space community, we've had companies big and small from all over the world reach out to us and have interest in this data. So clearly there's a need for an animal model in the genetic space that is hitting all those points. So we really think that we have a better way of developing AI for biological systems, and we will have a better way. A little bit about access to the data that we have. So we have direct-to-consumer access, not only in genetic data, but also in phenotypic data. Right now, we're developing applications and actually really interesting gamification ways of collecting phenotypic data from pet owners, which is really engaging, and it continues to surprise me how engaged our pet owners are after they've submitted a sample when we ask them for, at times we ask hundreds of questions, and those questions are actually answered. So this genotype to phenotype relationship, just to give you kind of an idea about it, so different cats like different foods and respond to drugs differently, and cats that are related have similar responses. Now, typically, households have multiple cats, and cats, actually, unlike dogs, have a more continuous spectrum, so they're more crossbred, which actually makes it really easy to connect genotypes and phenotypes for our research. And this is just a simple flow of how this works. So we collect genotypes from pet owners. We follow up in a few weeks with very interesting and exciting phenotype questions. We have really high response rates right now. We're trying to kind of create a model around that. We identify associations between phenotype and genotype, and then we continuously update the pet owner. So if any of you have done 23andMe or something similar, you've received your first report, and then you have a continuous update of things that 23andMe is discovering and updating you on. This is something that we will do as well. So right now, the feline database is quite small. There's not a lot that we know about it. As the database grows, we will continue to add more and more discoveries. So this is our current machine learning approach. So we apply deep learning on proprietary metric space for convolutional neural networks. We have a multi-agent model, one for each phenotype of interest, and we have a lot. We integrate with environmental and exposure data, and we conduct sensitivity analysis. If you ask me more questions about the machine learning part, I might actually ask you to talk to Sean. But if you have more questions about the way that felines right now are changing the genetic space, and in general how animal models are helping scientists, I'll be happy to answer those. So we really do think that BasePause is a platform resource for your research and development. We hope that by the beginning of 2018, we'll hit 3,000 samples, which is actually a pretty big number for how many cats we have in our database. These are genetic samples, and the phenotypic samples will follow after that. And we talk a lot about this, and I kind of want to leave you with this. Beyond just the DNA testing, beyond just receiving your kit, there's this notion that you can create products and services that are based on your pet's specific need. So when you walk into a pet store right now, you pick your pet food based on the cute cat on the box and the color of the box, really. You don't really pick it based on the biology of your cat. So following the trends in the human space, and by the way, this is a huge trend in the human space. Can we do personalized nutrition, personalized therapeutics using your genetic information? We really do think that this is going to be the future, and we think that this is going to be the same for pets. So in parallel to us creating this database and working with the data itself and creating models around it, we hope to be actually making products and services that is around a pet DNA. I think that's it. All right, thank you. I speak really fast, so I think I just plowed through that.
Anna, that was really great. It really was. And the branding, it's fantastic. I love the name, BasePause.
Oh, yeah?
It's really great.
Yeah, thank you.
Are there any questions for Anna? Come on, cat lovers out there. This is your time.
John?
Just, what do you mean by multi-agent systems?
So this is where I stopped and I said, please don't ask me questions about the machine learning.
I think you're talking about agent-based modeling,
right,
which is a different form of machine learning
to
some of the probabilistic methods.
You know what? I'll be happy to connect you with my co-founder, who will be super happy to answer your question.
I think, but I don't know. Yeah. I think there's a question back
here. So how does this help human medicine R&D?
Yep. So I mentioned briefly that cats are 90% similar to humans, actually. They're the closest mammal to humans outside of primates. So we believe that while human data right now is hard to get and expensive, it might be easier to be using animal data to do the initial modeling on some drug discoveries and R&D for pharma.
Any other questions? Yeah, there's one here at the back.
Hi, so how do you control the phenotypic data collect from the owners? Basically, they're just owners that have not been diagnostic or anyway. So how do you control that data?
When you say control, what do you mean by
the
control?
quality of or the accuracy
Right.
of the data
Right,
collect?
right. So we're starting out right now with just simple collection via questionnaires. So as we get the genetic data from the customer, we follow up multiple times in various ways to get questions answered. This is just our first foray into this. We've been quite surprised of how earnest and open the pet owners are to answering those questions. We've had very high success rates in trying to get people to respond and to fill it out completely. We do multiple things. So we've offered things like we'll donate to a shelter for you if you answer these questions. We've gamified some things to make it more fun. We're developing an application, like an iPhone app, to get you to respond to questions. All of that has been actually quite successful. Your point about the validity of those responses, we haven't hit on that yet.
Any other questions? Oh, there's one over here, lady at the back.
Karen Akinsanya. So it does turn out that cats are a pretty good model of heart failure. How much are you working with or talking to veterinarians, for example, where the issue of owners collecting phenotypic data versus practitioners collecting phenotypic data might be actually a way of getting a very rich data set that really has meaningful phenotypic data that can be then used for human discovery, human research?
Working with veterinarians is very difficult. It's very similar to working with doctors. They need absolute accuracy in our results. And because BaseBuzz, again, for biotech to have a product live and selling within the first year, we're really proud of our timing. However, the accuracy of our test and our predictions, we've had some vets tell us that until it's much better than what it is right now, they're not interested in selling and they're not interested in working with us. This has actually been a problem that has plagued there's two other companies that do similar things for dogs. Both of them have launched the product before they were fully ready, and the report wasn't 100% accurate. So you would get a different breed for your dog, or you would get a misdiagnosis on some variants that your dog did or didn't have, because that created this kind of a negative slant for genetic companies for pets. The vets that we have spoken with, they said, come back when you guys have better accuracy. And actually, we've had even harder time with breeders, which is a whole other sector of animals that will even get us even better phenotypic data. But I think we have until the second or third generation of our report where accuracy is very high. Those professionals will have to wait until we're there. And it's just a very honest answer.
Still, I mean, to have 3,000 samples within a year and have a product out to market is very impressive in that period of time. Are there any other questions? Oh, there's loads of questions. And we have time because you didn't talk for as long, so that's good. Great. So, Brendan.
Quick question. I've got lots of friends who are cat owners. What kinds of things would you be able to tell an owner of a cat right now, as opposed to the fact, I can tell you my cat comes from a rescue, it's a complete psychopath and will only eat fish. But will you tell me more than that?
Yeah. So right now, we can say there's three things that we'll focus on. We're doing a pretty good job with breed. There's 72 cat breeds in the world. We can, with pretty good accuracy, identify about 50 of them. Our breed reports come with huge caveats and bright red letters, but with every sample, those get better and better. We do something really fun called the Wild Kitten Index. And if you guys have done 23andMe, you might remember your Neanderthal index, which means absolutely nothing. But when it came to the 23andMe launch, it's like the one thing everyone talked about because it's fun and because it's a bit novelty. So we do something similar. We have the genomes of 18 biggest cats in the world, lions, tigers, pumas, some extinct cats. We can compare your cat to that wild cat. And if you know anything about genetics, you'd probably understand after I said this that every cat's the same. So it doesn't really matter, but we compare your cat and how it compares to our whole database, and then whether or not it's closer or farther away from the genome of that wild cat. It's really fun for cat owners to get that. They go gaga over that one. But when it comes to things like health and markers, we're not there yet. We need way more data to get to that point. A story came out in Wired today or yesterday about 23andMe. They just raised another round of funding, and now they're worth almost $2 billion, and it's hoo-ha, and it's great. But what's interesting for me to read in that is that when they had a big deal with Genentech where they sold $16 million worth of data to Genentech on a sample size that was something like 300 samples of Parkinson's patients. And then 2 years later, they just come back and said, not enough. So we know that you need thousands and thousands, and until we can get to a point where we can do like the Parkinson's of the cat world, we need probably another year or two of data collection. But we can do some of these. And you know, pet owners, they're weird. They like things like novelty. They would like to share that my cat is more tiger than lion, and they don't mind buying a product and waiting to get the real results in a year or two.
So I'll take one more question if anybody has one. I did see a couple of hands up earlier. Over here.
Have you identified which gene it is in cats that confers the extra 8 lives?
Excellent question.
No, not yet. I want to say that the funnest thing, just to kind of deviate from your question, but just to talk about something fun, we have something like 300 samples of polydactyl cats. Polydactyls when they have multiple, 6, 7, up to I think 7 toes, thumbs, and that's the third thing that we have in our test right now is we have a test for polydactylity. And so a lot of people ask us like really, really weird questions. Can you do this? Can you find out why my cat's freaking out at night? We can't really do any of that yet, but the fact that we have a polydactyl test, actually people really love that. So
excellent. Well, I think your a sort of future business direction should be to combine a wearable for cats with this, because that's the kind of the there's a lot of potential there for human medicine as well, isn't there?
Tons and tons of that.
Yeah.
Keep in mind, we are going to have hundreds of thousands of data samples, and so when it comes to building machine learning models, or when it comes to using genetic data for modeling and research, feline data, watch this space. It's going to become more and more talked about.
Anna, Skye, thank you very much. That was great.